what is this care that Ken so desperately wanted and needed and actually ultimately received? What is compassion? It's an emotional state. It rises in us when we're in the presence of someone else who is suffering, who is distressed, who's afraid, who's concerned. Compassion, if you practice it often enough, it moves from being an emotional state to a character trait. And some people believe that compassion acts as a moral barometer, that it closely tracks vulnerability, suffering, and need, and it guides attitudes and actions to relieve that distress and suffering in others. Whatever the motivation, I want to describe compassion as a three-part experience that requires first noticing that someone's in distress, second, feelings towards the other person, and third, action. I'm going to just take a few minutes to talk about what we think happens inside of us when we're in the presence of someone else who is suffering. And the first thing that happens to happen is we have to notice it. We have to notice it, and we have to attend. You know, that actually was the meaning of the word attending physician at one point. We have to attend to the needs and the suffering and the distress and concerns of other people. And that, I'm afraid, is a huge assumption, because we are so engulfed in tasks and in multitasking and all the other things that we have to do. So first, noticing is an assumption on our part. And I do have to say that I think that multitasking is the opposite of mindful presence. But if we should happen to notice that someone else is in trouble, we're hardwired to have an automatic, immediate emotional response. Our brains are just wired that way. That kind of emotional resonance is modulated by some kind of an appraisal of the situation that involves how relevant that person is to us or to our sense of ourselves and our personal and professional role, whether we think that person is deserving or blameworthy, like did they bring this on themselves somehow, and whether we have the resources to actually be able to help. And in health professional education, this is strongly influenced by something that's been called the hidden curriculum, even though it's not one bit hidden. It's in our plain sight, and it's how behaviors that are not necessarily compassionate nor patient-centered actually influence standards of what's supposed to be acceptable in the culture of medicine. And then there's the resources. Do we have the inner capacity and the external supports to actually be able to provide help? And that is the final common pathway, I think, between whether we experience compassion or burnout. There is something else that happens. That is called compassion regulation. And there's some new interesting studies that show that health professionals actually downregulate compassion. And you can see that this might be helpful because if we're repetitively faced with suffering, our own sense of personal distress impairs our ability to actually manage it or to actually provide the help that that person needs. We can't function. So we do have this process where we downregulate it in order to just be able to manage. And all of this is happening in this incredibly complicated healthcare system that we all either provide or receive care in. I think our job here is not to find the one right pathway. We have to go about this by attacking it from every which way. I'm going to quote Dr. Feinberg from an article that was published earlier this year in the New England Journal. To accelerate the pace of change, we must take different reinforcing actions simultaneously. In other words, we must tackle the problem in its entirety and on all fronts. So our job is not to find one right path. We want to become, as Liz Crocker said, a chorus of voices. We want to envision together what a compassionate healthcare system might look like and consider all of the many paths and the practical action steps that we might take to get us there. What we really want to do is create a social movement for change so that compassionate care becomes a professional norm and a public expectation.